who's here and also to everyone that's joining us online. So this is the third seminar of the Montreal Health Ethics Seminar Series. And as some of you must know by now, this is a seminar series that's organized by the Pragmatic Health Ethics Research Unit here at the IRCM. And so we meet on a monthly basis and we receive speakers from a wide variety of fields and bringing different perspectives to discuss topics in health ethics. And so our topic for the year 2018-2019 is the notion of moral awareness. And so our speakers are kind of addressing this topic, bringing their expertise from these different fields. Our speaker today is Dr. Matthew Hunt. So Dr. Hunt is Associate Professor and Director of Research at McGill University's School of Physical and Occupational Therapy. So we'll hear more about that today, but Dr. Hunt's research interests include questions in global health ethics and humanitarian health ethics, and he has extensive experience working on ethical issues surrounding disaster research and humanitarian aid, which I think we'll hear more about in the talk. And today he will be speaking to us about moral entanglement and the ethics of closing humanitarian healthcare projects. So please join me in welcoming Dr. Hunt.
Fantastic. Well, I just want to start by saying thank you. I appreciate the invitation and very much the opportunity to come and speak about a project that is right at the front of my mind because it's an ongoing project that we started sort of midway last year and is really ongoing. Lots of aspects of what I'm going to be discussing are, analysis that's underway, elements of what we're developing that are provisional, which is the sort of thing that I love to bring to a seminar like this because I'm hoping to have questions from you that can sharpen the analysis and the reflections that we're pursuing. So I'd welcome that aspect of discussion afterwards. But this is the focus, is thinking about questions related to obligations when humanitarian organizations are closing projects in the context of natural disasters, armed conflict, epidemic response, and what do they owe to the communities with whom they've been working, maybe to other partners, other organizations and entities that are there in place. I want to start by some acknowledgments. As I said, this is a research project that's underway. It's a project that's being conducted by a group of people, one of whom is here, Nicole Powell, who's helping to lead literature review on this topic. We do have a project partner of a humanitarian organization, Médecins du Monde Canada, and we're receiving funding from the Réseau de Recherche en Santé des Populations du Québec, and just also acknowledging the contribution of research participants, the people we've been interviewing over the course of this research. So I'm going to do a little bit of framing with the idea that maybe for a number of you, you haven't been thinking about humanitarian crisis and humanitarian response. So just to put this in context, here's sort of a very general definition of what we might think about a crisis circumstance. It's an event or a series of events where a community has been put into a situation of crisis where health, well-being is at risk in some significant way. And often it looks like the three categories that I described before, right? So questions of armed conflict, natural disaster, so-called natural disaster, or epidemic response, maybe situations of exclusion of different communities from access to care, maybe situations of forced migration. And these would be the sort of circumstances where international humanitarian organizations would be involved in responding to the needs of these communities. So if you are listening to me speak and you're trying to imagine what this looks like, I'm thinking about things like Médecins du Monde or MSF, Médecins Sans Frontières, Doctors of the World, Doctors Without Borders, the Red Cross, how they are responding in circumstances of humanitarian crisis. For the last 12 or 13 years, I've been studying questions related to ethics and humanitarian action. A lot of this work has been conducted in the context of a research group, the Humanitarian Health Ethics Research Group. So it's, again, collaborative projects. And at this point, think we've probably interviewed over 200 people involved in humanitarian response. The most recent project has been around the provision of palliative care in humanitarian action. So in these organizations focused on life-saving, what are the obligations, or how do you respond to the needs of people whose lives can't be saved? And other projects have been much more clinical in their orientation. We're often focusing on the direct response to people's needs in relation to health. But along the course or the trajectory of that program of research, there's been a question that's been sort of bubbling up for me. Going back to the very first study that I did during my master's in bioethics at McGill, one of the stories, when I was interviewing people about their ethical challenges, one of the stories was about closing a project. It wasn't about a provision of care to a patient. It wasn't about resource allocation within the project. It was actually about the really vexing, challenging circumstance when they were wrapping up and closing up a project. And there's a quotation actually from that first project that I'll share with you later in the presentation. But all, over these various projects, this issue keeps coming up, or keep bumping up against it. What about the ethics of closing projects? And interestingly, when we go and look at that, there really hasn't been that much discussion in the literature from the perspective of ethics about how to close projects well from an ethics perspective. And that's what we're trying to examine in the context of this project. What are the ethical considerations? How do we respond? What's at stake in terms of the ethics of closing projects? So just to say an obvious thing off the top is that in many circumstances, there will be projects that close relatively smoothly. So there'll be humanitarian projects that unfurl in a way that closure is not the vexing contentious situation that I'm going to describe in some detail. So there will be situations where objectives have been met, where local partners are able and willing to sustain the services or the programs that have been developed, and perhaps where the community has developed the capacity, greater capacity to respond to its own needs. So there are certainly lots of situations like this. Obviously, what I'm going to focus on are the ones that don't look like that, where we might experience this sort of situation, right? So often it isn't nearly so smooth. And here's a quote that illustrates that or captures some of that, the weight of that, saying the most difficult, the most movable, and the most emotive facet of humanitarian work is closing projects. And obviously the people who bear the most significant consequences of project closure are the communities who've been receiving services by humanitarian organizations. So as the projects are closed, they're the ones who might bear the most weight from those decisions. And in the context of our inquiry, there have been several sources that we've been turning to try and better understand this in the preliminary phases of our research. And I'm just going to point to 2 volumes that have been instructive about the implications of project closures for local communities. On the left is a project that was run by MSF when they were trying to understand how they were perceived by the communities they served, by other partners, by ministries of health, by other organizations. And so they looked at 9 sites of their projects, and there's a large ethnographic project which is published in this volume, In the Eyes of Others. And then on the right is another project called Time to Listen, Mary Anderson and colleagues seeking to try and understand from the perspective of people who are recipients of services by humanitarian organizations, what's their perception of the actions of humanitarian organizations. So these volumes sort of illustrate or draw attention to some of the ways in which project closure is experienced by communities. I should say the next phase of our own research, so we have a seed project at the moment, the next phase of our research aims to conduct case studies of actual project closures. But here are some quotations from each of the 2 volumes, or this is actually from a companion volume, but it captures some of the implications for a community. So in the context of this project, many respondents expressed that they're concerned about the lack of coherence in exit strategies. And they said, after closure, not only did patients lose access to their medical supply, the quality of care go down, the number of doctors, medical personnel decreased dramatically, but the population also had to pay for all services and drugs, which had been free in the context of the previous project. So there are concerns about coherence and planning, harmonization, and concerns about the legacy of the project. What happens when it's done? The sustainability of the services that are provided. Here's a second illustration of this from the other volume, Time to Listen. And this is an interview with a government official in Angola where she or he reported if in the course of delivering the aid, there had been awareness raising as to the fact that the aid was only temporary, would only be there to help them for a little while, they would have understood this, and the project closure would not be cause for such sorrow. And what I want to draw your attention to is that here the emphasis is around communication. It isn't around the nature that what's going to be left behind, but more about what's told to people, what people's expectations are, how their understanding of the nature of the project and its duration and what's going to happen after it's finished. So if you bear those things in mind as we move forward, I'm going to turn on to a few questions now of why projects are closed and how projects are closed. So one way of expressing this is that in the context of humanitarian action, project closure is, in a sense, routine. Almost all humanitarian projects are going to close. It's the nature, the life cycle of a humanitarian project. And when I say close, I don't just mean things that are closed completely. Often they're transitioned. There might be a handover to another entity. They might transition from a humanitarian relief project to a development orientation. But there are these decisions that are made, these threshold moments. And so in that context, organizations, people involved in these decisions, are going to factor in many different things. They're going to be thinking about sort of push factors, reasons for closing the projects that might push them to close. I'll give you some examples in a moment. There might be pull factors, so they're pulled away from the project because there's greater needs elsewhere, for example. And then there are stay factors, reasons why they feel like they should continue. They sort of weigh out these considerations and they decide, okay, we're going to continue the project in this place. So usually there's going to be many factors, and we could see situations, this is a bit of a caricature, but where they decide they're unable to continue, they do not need to continue, or they decide not to continue. So they might decide, there might be a force majeure situation, a situation of acute insecurity, where they feel like they cannot continue. Or there might be a situation where they no longer have access. So the government revokes the access that they have to a community, to a location, or a warring party, a belligerent party in a conflict says you can't continue. And then the third situation is when they lack resources to continue. It could be that it's a surgical project and they can't get an anesthetist, and so they can't continue. More often than not, it's around funding. It could be about material resources. But in the interviews we've been conducting and are continuing to conduct, the issue of funding keeps coming up, sort of single-year funding windows and uncertainty about whether the funding will be continued, and that this forces a more abrupt closure than they would wish. Then there are circumstances where they might, on balance, decide that they don't need to continue. And it might look like this, because someone else is doing or can do the job, so they could be handed over to another entity, or it looks like duplication, because the community situation has improved, because project objectives or external benchmarks have been met. And then this is the third category, and I think often this is maybe particularly interesting and maybe particularly challenging from an ethics perspective, situations where they decide not to continue. And here, it might be because after analysis, they say, well, the objectives cannot be met. We've reached a plateau. We cannot go further. The project isn't cost effective. It no longer matches the organizational mandate and priorities. Maybe the project has shifted over time and we have a particular mandate and this doesn't fit because of an ethics of refusal. So by this, I mean, if they see that their assistance is being co-opted or instrumentalized by people who are participants in a conflict, for example, on the basis of an ethic of refusal, they might say, we need to leave, we can't be complicit with what's happening here. Or because needs and vulnerability are greater elsewhere. But you can start to imagine that actually any of these raise really interesting ethical questions about these decisions to leave if people are still in a situation of precarity, if people are still in a situation where their situation is such that they have high needs and there aren't necessarily other ways of meeting them. So then how do we justify closing a project? And then how do we think about how could you do that well to close the project? And then I've sort of alluded to this. Projects can close in different ways. I think there was much more of the abrupt closure, sometimes called the cut and run, that used to happen. And critiques of this model are very clear in the literature. And what we see more of, or what people aspire to and don't always succeed at, are these sort of phasing approaches. You can phase down a project. Sometimes the project is diminished till there's just like a small remnant, so that it could be increased back up, for example, if the situation flares up again, or if it's a recurrent disaster. You know, there's another cycle of drought, there's another hurricane. Can you increase it again? Phasing over, so a gradual transition over to a partner, handing over, and phasing out, a gradual diminishment of the project. So all these things sort of capture the variety of ways in which project closure can occur. I'm sharing those largely as a setup for, obviously, the focus that I want to bring today, which is around what is ethically at stake. And there are different ways in which we can delaminate that question. We can sort of peel apart laminations and try and identify a series of questions that are going to be important and relevant for the analysis. So we can have a broad question of just like, what's the nature of the ethical dimensions of this situation around project closure? And then we can ask these sorts of questions, like what is the ethics of why projects are closed? Those justifications that I said before, those rationales. In a particular circumstance, or more generally, you could analyze the ethical justification of why you're closing a project. But then you could also ask questions about how such a decision is made. So questions more on the order of procedural justice. Are there things that ethics could say about how ought a decision to close, whether or not to close a project should be made? And then the third is questions about how it should be implemented. So sort of 4 levels: the general, what's ethically at stake, and then at least these 3 other lines of inquiry. And we, in the project, these are some of the things that we're discussing and thinking about. But our focus actually is less on the why, the justification. And in a sense, I think more discussion has occurred there. And we're trying to get actually past that. After a decision to close a project has been made, or in the process of making such a decision, what are the ethics of the how questions? So I thought, this is a slide about your seminar series. This was sort of an inspiration for me when Karine sent me the information about the seminar series. And the reason why I wanted to present this work is I think it actually is an interesting moment to, like, these questions actually really work for us here. What are the social psychological mechanisms of moral awareness? How do you cultivate moral sensitivity in individuals, in organizations, humanitarian organizations? How can we respond to moral distress? What is our personal, institutional, social responsibility in the face of awareness or unawareness of moral issues? Great question. So we're thinking about this and framing it like this. I think, okay, that helps us see something about, I think, this situation of ethical, the ethics of closing projects. So at the heart of some of these questions for closing projects is an ethical tension. And I'm going to show you 2 quotations from the same person. And this individual is a physician who has been involved in humanitarian response. She has also been a country lead for an organization responsible for closing projects and had a role at headquarters. So there's 3 different perspectives. And she talks about, or her interview sort of illustrates this core ethical tension. This is what she says when she's thinking as a doctor. As a doctor, as a clinician, when you're working in a place, I cannot ethically justify closing in most situations when we do, because it either doesn't make sense to open from the start, or there's like a terrifying tension in the moment when you stop providing certain essential treatments that people need. Think about that quote at the beginning from In the Eyes of Others, realizing that after you're done, people are going to lose access to healthcare services. Now they're going to have to pay, so maybe people who are in more precarious situations, already in a situation of precarity, they're the ones who are going to have less access, et cetera. So she finds this extremely difficult when she's thinking as a physician. And then she contrasts this with another line of sight, another angle of view on the ethical question. As a desk manager, there the calculation they have in mind is not whether the harm and benefit is positive or negative, but you have a much broader perspective when you think, okay, where can the organization have a higher benefit or harm? You're not reasoning on one place, but you're reasoning on the whole world. So I think one of the reasons why this is so difficult as an issue is if you adjust, you dial in or dial out your ethical gaze, you adjust your ethical gaze, you're going to focus in on different levels of analysis, right? So that's going to, this shows, in a sense, why this is déchirant, why this is a tension, why this pulls in different directions for organizations. And in some of these stories, there's actually this very specific tension between the field team and what might be happening at sort of a headquarters level or at a national level. Not always, but that can occur in terms of the narratives of project closure. And now some things about moral experience, sort of like living these out. And I'm going to share another quote from the same person. She's expressed this ethical tension. This is what she says. So one of your questions about the seminar series was around moral distress. Here's someone talking about a circumstance where she was responsible for closing a project. That time I really suffered a lot these discussions and felt huge distress due to the intrusion that political reasons or financial reasons were having over the reality of what we were dealing with. So feeling this as a tension. And so there are other things that we could say about the moral experience. One of them is sometimes like acknowledging that a project needs to close, but feeling regret that is so. Not necessarily remorse in the sense of feeling like a wrong thing has been done, though that might be the case, but still regret that it is that way, that there are greater needs elsewhere, that our resources are finite, and we have to make these choices. But sometimes also a sense of dissonance, too, between humanitarian values, the reasons why you're involved in humanitarian response, and what happens when a project is being closed. Peter Redfield is an anthropologist who works closely on issues of humanitarian action, has written a very excellent book called Life in Crisis. But one of the things he describes in relation to closing projects, he says that the demise of programs proves unsettling to humanitarian sensibilities. And that seems right? That's that dissonance that can occur. And so people might balk if they don't accept the justification or a decision appears overly hasty. Some might just feel relief that it's over. Someone was saying that at that point you just want it to be done quickly. And the stories are interesting. There are stories that I've heard, people's worries are about the staff that they hire rather than about the provision of care, right? So someone telling a story about the drivers on their program ending up in fistfights to try and position themselves to be the one who would be kept on longest in a program that was being phased down. Or another story about, well, what do we do with the pets that we've adopted in the project when the project closed? We've taken in these So people have all sorts of stories, all sorts of experiences where they feel discomfort in the context of closing projects. So back to what is ethically at stake. What I'm going to do now is try and develop a more theoretically informed account, not of the specific questions of why and how, but just of the nature of this situation. What is it about situations of project closure, about, that are giving rise to this sense of dissonance or moral uncertainty, the ethical tensions, and what does it suggest about how we could respond? And this builds on a chapter that I wrote with Jin Miao and we published last year. So there are sort of, the argument here is going to build. There are two things that I want to emphasize, and that's going to lead us to the idea of moral entanglement. And the first is around an observation that's both an empirical observation and then a more conceptual one that humanitarian projects don't just have instrumental value in terms of what services are provided, they have intrinsic value about relationships. And then the second one, which we'll come on to, is around governmentality, which is an observation more from political science. But here we can see two things about intrinsic value. I'm going to read something again from the Anderson book. They interviewed people who had received humanitarian aid to identify what they hoped to receive, in addition to significant positive and lasting change in the economic and material conditions of their communities. They also wanted to experience a sense of solidarity, colleagueship, and support with and from non-governmental organizations. And Lisa Fuller has developed, based on some empirical work, but a more philosophical analysis, to suggest that the nature of the relationships, the longer the duration of the project, the closer the interaction and the engagement, the more that they engender trust and hope and sense of solidarity, the more intrinsic are the values, not just instrumental, the values associated with the project. And that intrinsic value requires attention, and she argues that there are obligations associated or that come from the intrinsic as well as the instrumental. So not just a question of like continuity of services, but there are things about the relationships. And this observation, I have to say this is a topic where there's a lot more gray literature sources than academic literature sources. And this is a very good meeting report put out by MSF asking some questions about justice, not just in closing projects, but also in opening projects, but making this observation about relationships. So in any intervention, you set up expectations and relationships, and these have to be dealt with. So not just services, but about relationships. And then this is the second component, which is around governmentality. So Jennifer Rubinstein has written a book called Between Samaritans and States. In it, she talks about the political ethics of international non-governmental organizations. And she develops an account as a political scientist that humanitarian organizations are second best actors. They are doing things that would normally be done by governments, that they take on sort of semi-governmentality in the actions that they have. And so their obligations are about relationships, but they're also about the roles they hold and the power they exercise in these contexts. And so obligations flow from that element. So she says that especially as non-governmental organizations have ongoing relationships with entire populations, exercise coercive power over them, and help to shape the background conditions against which they live, they take on extra responsibilities based on democratic norms, humanitarian norms, distributive norms, and obligations flow from this idea of governmentality. And here's the quotation from that very first project that I did, the first set of interviews that I did over a decade ago, and this is the story that got me thinking about it. Canadian nurse talking about her experiences, and she said, there were about 1,500 kids that were followed. We were providing all the food every day. We were also feeding the people that were coming with them. We were feeding the staff. We were running the local economy. Pulling out was such a big political thing. And they were so upset after us because they were saying the situation will come again. So this political science analysis, the emphasis on the political dimension and the governmentality helps to capture some of the things related to the roles that humanitarian organizations might have in particular circumstances. And here I'm going to draw those together and talk about moral entanglement, which was in the title of the talk today. And I'm borrowing this from Henry Richardson, who was writing about situations of international research, where research is being conducted in low and middle income countries, and asking questions about, well, what are the obligations of researchers towards communities, and particularly around ancillary care obligations. And the idea of moral entanglements, that he has this whole theory of a partial entrustment theory, but the types of special obligations, so you'd say researchers and others, in this case health professionals or humanitarian organizations, have general responsibilities or general obligations, obligations of beneficence or duty of rescue, duty of care. But there might be special obligations that arise based on certain factors around the relationship that occurs, and around, in this analysis, the tightness or the closeness of the interaction, the degree of vulnerability that people experience, and not just absolute vulnerability, if there can be such a thing. I know you've been writing about vulnerability, Eric. But the situational vulnerability in the asking the question, if this project is removed or if this assistance is removed, then how worse off will the individuals be in relation? So it's a relative vulnerability in relation to the project. So comprehensiveness, the nature and duration of the relationship, the degree of vulnerability of community. So there's this graded notion of responsibilities based on these factors. And that's the notion of moral entanglement. And what I want to suggest is it pulls together this emphasis on both power and roles from Rubinstein and the nature of relationships, the question of solidarity, the intrinsic value from Fuller, and says something important, I think, about the nature of relationships, which would bring us on to the question then of, if that is so, if we have these moral entanglements, if it suggests something about special obligations, how should humanitarian organizations be thinking about that? What is the question of moral awareness in terms of responding then to situations in which there are these entanglements that are created? And so just to maybe make this a little bit clearer, the responsibilities, imagine you're a humanitarian organization and you've come in to do a vaccination campaign and you've vaccinated everyone who was eligible, and that was the specific focus of the project. It lasted a few weeks. You finish and you move on to the next community and you're doing that. The moral entanglement is very little. The types of relationship that's created, the vulnerabilities associated with that intervention, we can see in ways in which that this suggests actually the graded nature, as opposed to the project back here, feeding the community, running the local economy. This would be a situation of significant moral entanglement. And so the responsibilities at project closure are going to be different in this instance than in the situation of the vaccination campaign. So in continuing the analysis then, we're starting to think about the question, well then what ought that to look like? What might be some of the things that we could say about this situation that would help us understand how those special obligations associated with tighter moral entanglement, how can we live those out? And here's where I'm really testing out some ideas and would welcome feedback and discussion around them, because this is the work that we're doing in the project. I just have a slide to illustrate actually the architecture of the project, because maybe that's interesting even to think about or to discuss. We're drawing on 3 sources, both the critical interpretive review that Nicole is leading, engagement with wider scholarship in political philosophy, political science, and elsewhere, and then a series of interviews. So a first round of interviews. So we're interviewing everyone we speak to twice. The first interview is about their experiences of project closure, perspectives on project closure. All that is drawing towards trying to develop, sort of triangulating between sources, looking at these conversations between the literature, between more theoretical analysis and the narrative experiences towards drafting sort of ethics guidance. And then we have a second interview with every participant where we provide them with our latest iteration and get them to have them give us feedback on it, leading towards a workshop with experts and then trying to make some guidance open access and available for people. So that's the process we're working through. And this is an example of the sort of thing we imagined. This was draft 2. I think we're now on to draft 4 or 5. But something that's trying to capture what moral sensitivity or moral awareness would be like in this context. How can we provide a way of sort of like an angle of view on that ethical tension, giving a way of describing it, helping people to think about, well, how do we respond? And so this way we've shaped that up so far is like this, trying to identify or discuss sort of ethical capacities that we could develop, expand as individuals and as organizations, then articulate some ethical principles that we might seek to uphold, and identify ethical processes in making decisions and in enacting decisions. So that's really the ways in which we're cashing it out in terms of the ethics guidance. So I'm going to walk you through it briefly. I'm not actually going to talk about each piece because I don't think we have time for that. And then if you have questions about any element, feel welcome to ask during the question period. So our current articulation, again saying that this is provisional and we're still working on it, is to describe sort of 3 ethical capacities that we might look to develop: attentiveness, responsiveness, and foresight. So cash that out a little bit. I'm gonna say more about 2 of them. So first, responsiveness. So not just, we wanted to go beyond just sort of saying, here are the principles that we should have. But how can we actually develop and nurture ethical capacities? And this starts to capture it, recognizing that situations are dynamic, that every project is different. And it's going to be something that changes over time. So responsiveness in this account entails orienting and reorienting ourselves to anomalies, challenges, and changes, especially in relation to vulnerability. This sort of focus on being responsive. And drawing on Elise Springer's work, it requires a temporally continuous thread of attention to local context and flexibility and creativity to adapt closure and consequence. So how can we develop this capacity of responsiveness? And then the second is around attentiveness. This is the idea that focuses on the relational component. So recognition of others' needs and concerns, a critical self-awareness, and engaging with the social fabric of action, taking stock of relationships, background expectations, the ways in which they could come across in closing projects. So responsiveness to the circumstance, and then attentiveness in terms of focus on the relationships and the people involved. So I'm being selective here. The ethical principles that we describe, maybe less surprising: minimizing harms, fairness in how we do, and then sustainability. A lot of the emphasis being on actually continuity and sustainability. But let me just say something about minimizing harm. Obviously, risk analysis is part of the nature of closing projects, right? So some of these things might be obvious. People say that from a security perspective, the riskiest part of any project is the very start and the very finish of it, that there might be more insecurity in those moments. We need specific plans. There are risks associated. Like, what are you going to do with financial records? What are you going to do with patient records in the context of a project? So you might think about data from a risk perspective, minimizing harms. One of the participants described it as humanitarian malpractice to not identify the risks associated with the project. And in this instance, he's saying, like, making sure that all the MOUs, all the promises made at the beginning, the commitments made, that history of the project is something that you hold on to, is documented, so you can clarify these things so that you don't end up creating harms that need not be there. And then on the other side is questions about ethical processes, so largely drawing on sort of notions of procedural justice. So we could identify ethical processes in making decisions. So how ought organizations make a decision? These are at least some of the things that they might need to pay attention to: accountability, transparency, and collaboration. So I'll draw on transparency just to illustrate the sort of things that we want to do. Are the rationales well justified, and are they made available? Samia Hurst and colleagues writing about this topic have emphasized this notion that, people should should receive sort of frank discussion and declaration of what were the reasons that the project's been closed, receiving a frank answer to that situation. It's a question of demonstrating respect and perhaps also diminishing the likelihood that people feel abandoned or people feel resentment in light of the decision that's made. So we could identify that as a question of procedural justice in the context of making such a choice. And then how we enact decisions also raises these questions. And so here I would describe predictability, participation, and partnership. And I'll just describe predictability. Closure, obviously, is a situation which is likely to create uncertainty, where people who are involved, communities, but also partners, other organizations, the Ministry of Health, might be uncertain of what is happening. One example, one of the participants was describing that their organization has multiple national sections. And in one country, some of their organizations some of the entities might be pulling out, other ones are remaining. The Ministry of Health is uncertain about who's doing what. They're experiencing a lot of uncertainty. It's making project closure much more difficult. From the Anderson Time to Listen project and the interviews that they conducted, this is what they saw When people are not informed about the timing or conditions of a project's ending, some feel abandoned. Most say that this information would enable them to plan ahead and handle the departure with less disruption to their lives. So you can imagine the drivers working in that project that I described before. Is greater clarity going to help them in terms of the decisions that they make or the plans that they make, but also for communities. So we need communication, both of timelines, but also the steps that would be an important part of an ethical exit strategy. Those are oriented in terms of like how we roll out a project closure, obligations towards communities. I think there's some things that we could say too about, well, what are the obligations of humanitarian organizations to the people who work for them, both in terms of the expatriate staff who might be working with them, and then national staff, people they hire in the country where the project is occurring. And in many instances, that is generally that's a much larger group of people. Some organizations, 90% of their staff are national staff members. So what are the obligations that are owed? This is one of the participants who was talking about being ill-prepared for her first experience of project closure, saying there needs to be a higher, and so there's a higher need of providing external support, external oversight, and really the sharing of responsibility at all levels. Feeling thrust in a situation she was ill-prepared to handle, and so looking for more support. So I'd say at least these things. Organizations can have, as well as thinking about the specific project closure and the things I already described, policies, ways that they orient their practice, how can they provide guidance in that sense, making sure that the people involved, so the person from the last quote took on the leadership of a project not knowing that a decision had already been made to close it, not having experienced it before, and felt therefore ill-prepared. So the people involved had the adequate preparation and training, that there's ways of sharing the weight of responsibility as she described. And then I think there's an obligation to evaluate and to learn. And here actually is a really big challenge. These are project closures. These are reactive organizations. They finish here and they move on to another emergency. So learning about what happens after a project is closed becomes quite difficult. And funders generally don't support that sort of post-project evaluation. I think those questions about legacy and evaluation and learning are an obligation, but there are structural challenges to do that. So here's some of the conclusion then. So the ends and exits. The first is to say that they're inescapable, right? So that this is the nature of humanitarian work, that projects will come to an end. And so it's a question of being ready for the why, how questions that I raised. As someone's described, when is our time to go? And being sensitive to that. And then developing strategies to respond and to act in ways that are responsive to this idea of moral entanglement. Acknowledging the issues around governmentality, the issues around relationship, and then what are the obligations that flow from an understanding of moral entanglement, as well as recognition of the ethical hazards associated with ending projects. And that is where I'm going to finish. Thank you very much.
Thanks, Matthew. So just on the topic of governmentality, I was just curious, given the assertion that governmentality maybe creates sort of quasi political obligations for NGOs, does that also extend to sort of the ethics guidance you're creating? So how do you understand sort of the project's accountability to the people it'll eventually impact, given that probably different stakeholders will have different inputs and different opinions about the guidance? And so I wonder if you could say a bit more about that.
All right. So just to make sure that I'm clear, are you asking about even the process of generating guidance? Yeah.
That's right.
Yeah, fantastic. So this is a really interesting challenge. So the architecture that I described in the process, in this project, I wanted to share because it's different than how we've done this before. And there's some interesting questions about how we develop guidance in especially around empirically driven bioethics work, right? Some empirical bioethics work. So we've been trying to be careful around some of those questions, and There are worries about sort of the naturalistic fallacy of is and ought and moving between them. So one of the responses is this notion actually of trying to draw together different sources of knowledge and expertise. So, to really canvas what is known in terms of both the gray and the academic literature, what's out there in terms of knowledge base, what we can draw from the narrative type empirical work that we're doing, and then sort of this close engagement with different literatures and theoretically driven work. And so drawing those things together and then building into it this sort of iteration process, right? So this back and forthness. And there's a way in which we're going to seek input from individuals who've been involved, and then the idea of the workshop. And when we're done, the idea is that it's a living document that will receive more feedback. So it's an attempt actually to be mindful of some of those things. And I don't know if you have reflections on ways that it could be refined further. But actually, I think that your question strikes to the heart, actually, of a big challenge in empirical bioethics and policy-oriented bioethics work.
I'll think about refinements, but thank you.
Thanks.
Thank you, Matthew, for a very interesting presentation. I'm just going to draw on our pre-presentation conversation, because in my experience in teaching in global health, we were really quite enamored with the community-based rehab model, which has sustainability of intervention as its core, and specifically talks about not going into a project until you've made a plan to get out of there, and also deals with empowering the local people and moving on and leaving things as autonomous as they can be before you got there. And this, particularly in Africa, is a decades-old discussion, because sending food to Africa has had different outcomes in terms of dependency, and so the whole idea of when to pull out. And I'm just wondering if there's any way to influence this type of an intervention, because I get that it's more crisis-oriented, perhaps, than something that would qualify for community-based rehab.
Right.
But just the whole idea that intervention means thinking about your last day. Like starting begins with an understanding of what your last day is going to be about. And is that difficult to influence at the policy level, at a values level? Is there room for some change of interpretation so that you're not dealing with surprises like this?
Right. Yeah, I think that's an excellent set of questions and observations. There are ways in which the humanitarian context is going to be different than community-based rehabilitation or development projects more generally, that have this orientation that are built with the idea of sustainability. I think this is one thing that humanitarian organizations are aware of, thinking carefully about, and yet it pulls against the sort of reactive, responsive nature of a crisis. We respond, and then there are other crises. And the analysis of governmentality is interesting, because it would say maybe two things. One is that actually there's a negative duty to not replace first best actors, so governments and local institutions, when those are available. So it's actually suggesting that you should get out of the way. Humanitarian organizations should get out of the way once first best actor can take back on that role. So orienting towards handover and partnership is what makes sense in the humanitarian context. And then the positive duty actually might be, well, how do you organize a humanitarian response that also can build capacity in some way? That the efforts are made, for example, to harmonize what you're doing with what's going to happen after you go. So you're not instituting new regimes or different regimes. You're planning it in a way that there's less disruption once you leave. One of the critiques of humanitarianism is that it's, the temporal present. It's all about the right now. And there's less attention to what's come before and less attention to what's going to happen afterwards. Maybe that also captures some of this tension and challenge for the humanitarian context. Yeah, thank you.
Any other questions? Non, je pense pas qu'on en a. J'ai pas regardé. Est-ce qu'on a des questions sur le feed? Non. Okay. So if there aren't Did you have if there aren't any more questions, maybe we can just end here. And thank you again for being here with us today.
Thank you for the invitation.
Jusqu'à 11 personnes.
Cool.
Ouais, que depuis la
Là, j'imagine
You're
ça.
lucky you get to work with Carolyn. And what are you planning on working on? Stuff that I've been working on with Carolyn. Well, this is very different, but the last time when I presented here, actually the last time I came was when Carolyn was presenting.